Hi, everyone, and welcome to the Community Engagement Series. My name is Priscilla Medeiros. I'm the Knowledge Mobilization and Community Engagement Specialist at the Edwin S.H. Leong Center for Healthy Children, as well as your moderator for the series. I'm incredibly excited to introduce our speaker for today's webinar. We're joined by Dr. Sarah Munce, who's the Senior Scientist and Associate Chief of Implementation Science at the Bloorview Research Institute, Holland Bloorview Kids Rehabilitation Hospital, and an associate professor at the Dalla Lana School of Public Health. In 2025, she was also awarded a CIHR Implementation Science Chair to advance youth and family engagement in learning health systems across Canada. So today's presentation will provide a working definition of co-design and articulate its role in the development of complex health interventions, describe the models, theories, and frameworks currently being used to guide co-design, and to explain how these findings are informing the next phase of this particular project, which is culminating in a ready-to-implement precise reporting guideline that specifies a minimum set of items for transparently reporting co-design. So thank you so much, Sarah, for joining us. I'll now pass it over to you for our presentation.
Great. Thanks so much, Priscilla, for the introduction and the opportunity to present this work on behalf of the team. Really nice to see so many familiar names and faces on the call today. So thanks very much for joining. So I'll be presenting phase one from an initiative that we call the Precise Initiative, as Priscilla said. So developing the preferred components for co-design and research reporting guidelines. And these are the results from our scoping review. So in terms of the agenda for today, touching on, what is co-design? We're hearing that term being used a lot of late. The challenges in co-design, which many of you who have an interest in this area are likely familiar with. Then giving you some details about our Precise initiative, the overall objectives, specific objectives, and the methods. As promised, the results from our scoping review. A heads up, there are a lot of results, and then an opportunity to have a discussion. So what is co-design? And this was maybe me, back in 2021 when I was thinking about co-designing a peer support intervention, and wanted to delve into the literature to find out what's involved, and really wanted to know what are the back then, I really, started from a place where, what are the right methods or methodology. And as my thinking and collaborations evolved, came to understand or ask about, what are the principles involved in co-design? Is it more generally, a process, an approach? Of late, started to think about co-design as a intervention in and of itself. I've been really influenced by the work of K.A. McKercher. They've written a really excellent little book on co-design that I would highly recommend, called Beyond Sticky Notes. And as many of us have heard, co-design is designing with and not for. And specifically, they articulate that co-design brings together lived experience, lived expertise, and professional experience to learn from each other and make things better by design. And perhaps obviously, but not so obviously when you delve into the literature, K.A. McKercher articulates that co-design has both a co-aspect and a design aspect. And I'll come back to that point when I delve into some of our results. So, why does it matter in healthcare? And, with this audience, I likely don't need to articulate those reasons. We often hear that, doing co-design leads to more relevant, appropriate, sustainable, implementable interventions. Cheryl Grindle in 2022 conducted a nice systematic review looking at part of the review looked at some of the benefits of co-design and found, sort of various results, including, increased consistency in clinician assessment and identification of patient problems that were previously missed, all the way to, reported improvements in healthcare utilization outcomes. So, including, decreased hospital visits. They found, additional beneficial outcomes such as improved patient satisfaction, both that were demonstrated or that were believed to be possible. Despite these benefits, though, again, and likely not new to this audience, are the challenges of meaningful co-design, right? And again, this is increasingly being reported in the literature, and really is, these challenges are the basis of this precise initiative and what we are the gap that we're hoping to bridge. So certainly others have reported, a lack of transparency, really confusion about what co-design is. I've heard this term called, co-design washing. So we, sprinkle co-design or co-words, throughout our proposals, but, don't sort of assign meaningful processes with those words. Of course, there are challenges with navigating relationships, including the extra time that it takes to work with various partners. So that leads to or is associated with logistical challenges and concerns as well as ethical concerns. And then, finally, this need to balance, structure and creativity. So many of you will be familiar with the fact that, co-design can involve, quite creative pursuits. But, how do you balance that within, say, the confines of a research project or even when proposing your co-design activities. So I really liked this meme from one of my favorite movies, The Princess Bride, certainly relevant in this context. So, you keep using that word. I do not think it means what you think it means. So really speaking to that, co-sprinkling, sort of co-design washing. So yeah, I similarly had a giggle the first time I saw that. So that all of these challenges and sort of negotiating this space, led to this idea then of the co-design of the preferred components for co-design research or the precise guideline. And what we're trying to do here is promote the consistency, transparency, and quality of reporting co-design studies that are used to develop complex health interventions. The QR code for our protocol paper is included here. So as I mentioned, the project, in line with other reporting guidelines, has two phases. So the scoping review is the focus of the presentation today. So aiming to synthesize the literature, on the specifically on the models, theories, and frameworks used to co-design complex health intervention to identify their common elements. And then the phase that we're launching into now is the modified Delphi process, which is to prioritize the co-design components, values and principles, associated methods and methodologies, and outcomes to be included in the guideline. I think I've just included the specific objectives of the scoping review, which, as you might imagine, is to map the extent of the literature. And again, we're looking specifically at the models, theories, and frameworks that were used, or those studies that used a model, theory, or framework. And then we have synthesized the key characteristics and the common elements. So in terms of our Prisma flow diagram here, so at a high level, so we screened almost 30,000 articles for our level 2 screening or full text screening. We reviewed just under 700 articles, and 130 articles are included in the final review. So as promised, or as warned, I'll walk you through a bunch of results, and then summarize some of the key takeaways. So in terms of countries represented in the included studies, so most of the representation, I think not surprisingly, was from the UK, Australia, Europe, non-UK studies, and then North America. And this is certainly follows the representation that we have on our study team. We were also interested in the study settings, so most of the included studies, the co-design, the studies were conducted in the community, but you can see that there are other diverse settings, including hospital settings. Some of the studies it was unclear, some of the studies it was across multiple settings. Again, the health conditions included are various, but most of the studies were in cancer, neurological conditions, and mental illness. In terms of the methodological characteristics, and again, perhaps not surprisingly, 62% of the included studies were mixed or multiple methods, or at least characterized as such. Interestingly, in 15% of the studies, the actual study design was unclear. And what I mean by that was what was only reported was that workshops or meetings were held. So ambiguity in the study design used. This finding we found particularly interesting, and is in line with some findings that from our UK colleagues. And this particular item was extracted based on advice from our UK patient partner. And so in 16% of the studies, ethical approval, there was no approval. And I can come back to that point later. In 83% of the studies, there was no statement about positionality, reflexivity, or identity, which is particularly important in conducting this work. And I would say surprising given the preponderance of mixed and qualitative studies. Co-design definitions we also looked at. So most of the studies did indicate using the term co-design, but studies also, again, in line with what we know, used multiple terms. And actually in 34 studies, a co-term was not used in the methods section. So again, in line with what we've seen around ambiguity in terms of process. We were also interested in whether a specific citation was used, and we found that in almost 70% of the studies, no specific citation was used. So important when we wanted, if we want to have an understanding of, what sort of, where authors are coming from in terms of their co-design approach. Uh, This finding, again, I think is interesting, but again, if you know the literature and are familiar with some similar reviews, not surprising. So actually in 40% of the studies, there was no evidence of co-design partners. And by co-design partners, we meant those individuals that had a decision-making role in the study. The next set of results relates to those studies that did identify partners or did where there was evidence of partnership. We saw lots of heterogeneity in terms of the partners involved. So, patient and family partners, healthcare providers, and among that other category, you can see that was quite diverse as well. Poor reportings among the partners themselves, so really limited reporting in terms of the sex and gender of the partners involved. We also wanted to track the specific partner role. So among those 78 studies, most did provide specific descriptions on the partner roles, and we used in line with our love of frameworks, we did use a specific framework to track those roles. So we used the OBI framework for ways community partners can be engaged to describe the different roles of partners. So, not surprising for a co-design review that in most of the studies there was evidence of partnership in developing the intervention, the program or the app, and then followed by planning the study and conducting the study. And you can see really as the research cycle advances, that partnership wanes, or there was less evidence of partnership at the later stages of the research cycle. So, including partnership on disseminating the results. We're hearing a lot about, of course, the importance of remuneration. So not compensation, but paying partners, for their expertise, and then also, training, which increasingly we're discussing, and then the outcomes for co-design partners. So again, in the minority of studies, these aspects were reported on, and certainly this finding will be influential in terms of will be particularly influential in terms of the guideline itself. I think that element is sure to be included. Co-design principles. Again, many of the studies included or reported on at least one principle, and really important when we recognize the centrality of principles in the use of our co-design work. But still, among 12 studies, no principles or enacting those principles were evident. And again, we used key principles identified by K.A. McKercher. So, using participatory means was the principle most commonly identified, followed by prioritizing relationships, sharing power, and then building capacity. The Some scholars, co-design scholars, argue that sharing power is the most important principle in co-design work, and so you know, disappointing to see that a lower number of studies reported this particular principle. If we delve then into the models, theories, and frameworks that were identified, and here again we were guided by Kay McKercher's work in terms of classifying frameworks by design-only MTFs, co-plus design MTFs, and then co-plus MTFs. We use this categorization to guide our extraction. Most of the included studies included a design-only framework, followed by a co-plus design, and the minority of studies used a co-only framework. When we look at how those frameworks were operationalized, 2/3 of the studies did provide evidence of operationalizing their frameworks, but certainly, there's more work that can be done in terms of linking specific constructs of a framework. To how it's applied. So some of the common co-plus design frameworks that we identified were the double diamond framework. We included some EBCD frameworks that had specific phases or constructs. Also, the design thinking framework was also commonly used. We also wanted to, as I wind down some of the results here, we were also interested in, given the challenges in co-design, given the increasing recognition of the challenges with co-design reporting, we were interested whether included studies made any recommendations around elements for co-design reporting. And perhaps not surprisingly, the majority did not make any recommendations. So this was we tried to capture this information, but really, the majority did not make any recommendations. And in the two studies that we did identify, some of the reported suggestions included, describing and using and operationalizing the models, theories, and frameworks. Certainly the overall need for transparent reporting, and then the importance of including co-design principles and being transparent about those principles. So in terms of, I know that's a lot of results, and certainly this has been a large undertaking for the team. I think really, if I summarize all of that, we've one of the key gaps is the intentional use of definitions with citations to orient audiences about their definition of co-design and where they're coming from in terms of how they're practicing co-design. Weak use or operationalizing the MTFs involved. Again, we're still the issue of methodological transparency continues to persist, despite earlier reviews having identified similar issues. Um, Similarly, we see, confusion around, partners versus participants. So, again, recall the finding that, in 40% of the studies, there is no evidence of that partnership piece of that shared decision-making role. We see also, poor reporting of, power and governance, which is, particularly striking given the importance of power dynamics, power sharing in the co-design process. And then really sort of fragmented engagement across the stages with there being really sort of a decline in the partnership or engagement as that research process persists or evolves. This takes me to where we are now with the project, which is developing the survey that we will be circulating as part of our modified Delphi process. Based on these results, we've come up with these high-level areas that we want our Delphi participants to rate on. Certainly, and I'll say too that each of these areas includes specific items. But for today, I just provided I provided an example or a few examples. So in terms of the study design and methods, asking participants or including in the guideline to clearly identify the specific study design in which the co-design activities were embedded. Also asking participants about terminology, so being transparent about the specific citation they've used when they're as part of their conceptual definition of co-design. The use of the models, theories, frameworks, although it has featured prominently in our scoping review, I think its role in the reporting guideline is up for debate. If it is, it is an aspect that we will ask participants to rate the importance of, and so. One of the areas may be, identify the MTF and how it was used to guide the co-design process and the justification for its selection. And I think that that contentiousness, does speak to balancing that need for creativity with structure. Certainly, the co-design partners is an important area, and asking authors to, for example, identify how co-design partners were recruited, describe the co-design partners, and really that piece around distinguishing between co-design partners versus participants in the process. I think increasingly we're recognizing the importance of training in co-design as well as engagement work and training for both the partners, but also starting to think about training for the researchers. That is an item again that we're including in our survey, being transparent about remuneration, as well as reporting on the use of decision logs and how decisions were made, how any conflicts, for example, were dealt with. Um, the last two areas then relate to principles and values, as well as outputs and impacts. So again, we chose to focus on the four principles articulated by McKercher, and I think those will be um, uh, those could be the ones that feature in our in the precise guideline. And, specifically, it may include, asking participants to be, or asking authors to be transparent about, how power imbalances were addressed, for example, or how power sharing was dealt with. And then finally, another key area relates to co-design outputs and impacts. So of course, reporting on the intervention itself that has been co-designed, but also potentially on impacts to the partners themselves, perhaps to the researchers themselves, maybe some other identified areas as part of the final guideline. So in terms of our next step, so um, completing the scoping review, or the scoping review is complete. So we're submitting those results for publication, and then quickly moving to developing the surveys, which will be circulated as part of our modified Delphi process, and then culminating in our consensus meeting, which will be held in November of this year, with the aim to disseminate the guidelines in early 2027. And with that, that's the conclusion of my presentation. So again, thank you all for your interest in this initiative, which is certainly a team effort. And I'd love to get your feedback, entertain any questions, and have a discussion. So thanks again.
Thank you so much for such a great presentation, Sarah. There was a lot of activity in the chat. I could see people nodding their head in agreement with what you were sharing, and certainly a lot of excitement around the release of this when the time comes in the fall. So at this time, I'd like to ask if anyone has any questions to please feel free to raise their virtual hands. You're also welcome to leave your questions in the chat for the speaker, and I'm happy to draw that to her attention. I see a comment in the chat from Melanie Barwick reading, it's important to measure the co-design process and power imbalance, whether co-design was meaningful and equitable, and whether it improves outcomes. This might be captured in your guideline, not sure. Not sure if you want to just comment on that, Sarah, about the considerations of that piece in the guideline.
Yeah, thanks so much, Melanie, and thanks for joining today. Yeah, I mean, so again, so we are developing the survey for dissemination to leading to the culmination of the guideline. I mean, I think that power sharing piece is a central will be a central aspect of the principles component. Um, some co-design, co-pro scholars indicate it's the most important, that the power sharing piece is, the most important of the principles. So I think the power sharing, power dynamics will be heavily featured in the guideline. It's interesting to think too about whether we give a weighting to certain elements of the guideline, whether we indicate that of the principles that we ask authors to report on, whether more importance is assigned to power, for example. So that I think is to be determined. But
One
certainly, yeah,
one of the thoughts I have,
yeah,
because I'm more familiar with the STARI guidelines, that has sort of the two parallel. I feel this is similar in the
mhm,
sense that often studies that have a co-design approach will have sort of a parallel approach that focuses on the specific intervention or the thing they're trying to co-design and how that works in the world. And then the methods related to the actual co-design process itself or methodology. And that would be one way to maybe think about designing your actual checklist, because I've reviewed a lot of supposedly co-design
yeah,
research studies, and some there's variability in how well they describe the co-design process,
that's
but where there was the biggest weakness was in being able to demonstrate at the end of their work that they actually did good quality co-design,
yes,
right?
yeah,
It's a lot of it is uh you know what's the word I'm looking for, like they say what they're going to do rather than how they're going to show that they did it,
yes, yeah,
right?
yeah,
And that's the biggest weakness. And as you showed in your review, I think the methodologies about how to do it, what are the characteristics, how do you measure it, are just starting to emerge. It's sort of a growing area in this field. But that's been my experience with it. And I think the way the STARI guidelines are laid out might be helpful with your checklist.
yeah. Thanks, Melanie. Yeah, that's really
Welcome.
helpful.
But great work. It's nice to see this work
Yeah,
coming up as something important for everybody. It's certainly, especially when it's a buzzword like this,
yeah.
you got to be really careful that you are actually doing what you say you're doing.
Yes, exactly, and that was the certainly the genesis for the work. Yeah, yeah, I appreciate that. And we'll take a re-review of Starry to help us formulate the guidelines. Thanks, Melanie.
Thank you. Megan, I see your hands raised if you'd like to go next.
Yeah, thank you so much, Sarah, for that talk. And I think actually where I'm going might be building or might actually be partially answered by the discussion you were just having with Melanie. I utilized experience-based co-design in my doctoral work and am framing the use of the double diamond in postdoc work that I'm doing right now. And I feel like some of the tension when reporting these results is that piece around wanting to report in detail the methods that you're utilizing and the principles and alignment, which can be pretty fulsome alongside also projects that generate a lot of data. And so I know for myself, I'd published two different manuscripts to try and break up some of that data. So I think my question was similar along those lines, whether the reporting guidelines would consider like reporting across a project or within a manuscript, just knowing that these can be really big in multiple ways.
Yes, yeah, it's such a good yeah, it's such a good point. Sort of that um, the longitudinal nature of the work. Um,
Hmm.
it's definitely something to be considered. I don't know whether part of it may be one thing I've been thinking about of late is the inclusion of a plan, like at least like um, a, a plan for the work that is in line with, say, the double diamond um, uh, framework, where where you yeah you include sort of the high level the high level plan, even though all of the elements of the double diamond may not be reported on in one study. Similar to what we do in mixed methods designs, where we indicate sort of or where we show a figure where we indicate points of integration.
Okay.
So it's an excellent point that some of the reporting gaps may be a function of kind of the longitudinal nature of the work, and I think it's a really important consideration. Um, having said that, I mean, I can think of included studies that um, you know still did report on all phases of the double diamond. So that's certainly a more kind of simplistic example where um, you would be able to um, use the guidelines within the context of one study. But I think it's a great point in terms of considering the longitudinal nature of the work.
Yeah, well, thank you for this presentation. It was great. I know co-design can feel a little bit like the Wild West, so it's neat to see this like taking shape and where it can inform us moving forward.
Thanks, Megan. Thanks so much.
Thank you. Kelly, your hand is up next.
There we go. You mute. Hi, Sarah. Thanks so
Hey,
much for
Kelly.
your talk. I told you I'd come, and I'm here. I love this work that you're doing. Have been doing for some time now. Uh, I'm not sure in terms of your review, because you had indicated in terms of limited reporting, but some of the work that I'm involved in is working with youth who experience disabilities, but maybe some other people on this call. And I was curious because there was quite a few studies you flagged in terms of youth and co-design. Was there mention around accessibility, like in terms of making, those different phases of research? Something we have many conversations in our team is how do you ensure that, all youth can participate? And so I'm just curious of the studies that included youth, if you can maybe speak to, or just in general, I think not just youth, accessibility aspect of things.
Yeah, no, it's a great question. For this project, Kelly, I haven't, surprisingly, I haven't looked at those studies specifically. And now now that you've asked that, I'm going to. Um, but yeah, the of course the accessibility uh, piece is a really important issue. In our other work, it is something that we give a lot of consideration for in terms of how we can um, um, how we can make the partnership process um, accessible, whether it's the time of day that we offer, partnership meetings, the meetings itself. We've given a lot of thought to how we hold meetings, and are they they tend to be very formal, like on a Zoom call, like this. Is that the best way to to engage young people? Other colleagues do things like hackathons, um, do use some sort of more creative methods for engagement. Um, we've done some work around, I think, as I've shared, being very upfront about, how youth partners, want to be engaged, and being very clear about that upfront. So, establishing a reference document. So, we know how those partners, what their preferences are in terms of engagement. Um, so now after this call, I'm going to go look at those youth studies, but I haven't taken a look for the precise project, but is certainly something that we think about a lot for our youth engagement work. Yeah.
Yeah, I appreciate that, Sarah. And I was also just thinking, like, in terms of things around reimbursement and the ability to do this work. those the extra funds, and it also may limit who is part of this. So I think the reporting is so important of like how it's being done and maybe who is then still excluded to then how can we actually look at ways of being more inclusive with co-design.
Yeah.
I'll be quiet.
No. I love the question. Thanks, Kelly. And I'll say too, another thing that we've been thinking about of late is, when in terms of, thinking about, outputs and, which, may be a category for our, final guideline is I think there's often the assumption and particularly relevant for working with youth that, academic outputs are preferred, right? That, if we, put, if youth partners are a part of our publications, that's important. And it may be, but it may not be. And so again, I think, having those conversations at the outset with partners about what outputs are important to them as part of this work is really important. And so again, I think that it would be interesting to see, but I think that could be a very relevant item for the guideline.
Great question. Michelle, your hand is raised. It's so nice to see you.
Nice to see you and nice to see you, Sarah.
Michelle.
You mentioned something just in passing in your presentation around partner versus participant, and I often struggle with that in co-design projects because there's this double layer almost of involvement with our team, and I would say partners often involve start to end, and participants maybe at more specific tasks, even if it's at multiple stages in the project. But would your guideline be appropriate for use for both of those roles or one of those roles?
Yeah, so I think that, yeah, it's a great question. There can be, overlap in terms of, a participant role and a partner role. What the gaps that we saw in those studies was where the partnership piece wasn't made evident, like the individuals that had, as I say, that decision making role, among those, for 40%, there was no evidence of the partnership piece. So certainly there can be, overlap between, participant and partner, but in terms of our definition of co-design partner, we were suggesting that there needs to be evidence of that decision-making power. So I'm not sure if is that answering your question?
Yeah, I'm thinking there's probably decision-making power needed for both partners and the participants if it's a true
Mm,
design. But anyway, we can chat sometime over tea.
yeah, yeah. No, interesting. Thank you.
Really interesting question. I want to take us into the chat. There are a couple of questions I'd like to make sure are covered. First is, as a research assistant, what kinds of information should we be capturing during co-design activities to support better reporting?
Yeah, so I think the proposed, um I mean, I'm biased, but I think the proposed list of items is a start. And certainly, I've had a fair number of researchers reach out with, similar questions. Um, I think for me, I think the principles piece is important. And I think that was something that was not clear to me sort of early in my co-design journey. So I think, as a start, those four principles articulated by Kay McKercher are really important. Um, I think how partners are involved. Are they involved in planning? Are they involved in recruitment? So articulating the roles, or their roles in the research process. Um, And then for me, I think that characterizing or describing the partners as well is very important. So who they are, sex, gender, their knowledge user group, I think are some key areas as well as the other areas that I identified in that list. But I think in particular, I think those three areas as a start are key.
Perfect. Still have another question, actually two more questions to cover. I see they're trickling in. This question comes from Amy, and I think it's an interesting one. Is there a co-design evaluation tool that you've used? I know, Michelle, you've chimed in and you've shared one that I too have certainly gleaned, but Sarah, I'm curious what you're pulling in order to kind of wade into the waters of co-design evaluation.
Yeah, I mean, in terms of engagement, if you're engagement evaluation, so we've used things like the PPEAT or the Peers 22. I mean that the evaluation piece, again, I think will likely be covered as part of the guideline and, may suggest, doing an evaluation of co-design as part of the impact of the co-design work. So as part of co-design work, I haven't used a specific tool, but in our engagement work, our co-creation work, we've used things like the PPEAT or the Peers 22.
Perfect. I think that's a great response. I too often go to those two to start off. I know there are many different evaluation options that are out there. It's finding the best fit for what you're planning to use. But certainly the Pete is one of my favorites, I have to say.
Yeah, I think the evaluation piece is a really is a really interesting area. And even, at the beginning of my talk, even talking about co-design as an intervention. Like we know, thinking about the youth literature as well, we know that, reported benefits include, increased confidence, peer support, social connection, right? So there's an aspect of those kind of, transformational co-design or transformational outcomes that could also be considered, in addition to, did I feel that the, relational aspects of the project were meaningful, or there was, good power sharing. I think, some of those partner impacts and even, researcher impacts would be interesting to capture.
Perfect. I think this last question I see in the chat, maybe more of a comment, but potentially you could chime in, Sarah. So they're currently co-designing a project with existing patient partners and plan to recruit a few more. They're quite unsure if they need to get REB approval and consent from patient partners, since they'll be completing survey questionnaires, as well as contribute to 3 co-design workshops. What would your advice be based on your experience as to whether they should sit on one side or the other?
And sorry, sit on one side or the
Of the
other.
fence, sorry, if they should
Oh,
be proceeding and achieving and receiving REB approval or not.
yeah, my, yeah, I mean, without without knowing,
Yeah.
all the details of the project, but I mean, I would pursue REB approval. I, had shown those results around, I forget the specific percentage, but not an insignificant number of studies did not have REB approval or was not reported as part of the studies. We know, for example, in the UK that PPI, REB approval is not required. And indeed, we did notice a signal that the most of those studies were UK-based studies. But it gets tricky, right? Because then if, there's no evidence of partnership, are you actually doing a co-design study, or are you doing, a qualitative study where you're collecting data, analyzing that data, and getting feedback. So I don't know all the specifics, but generally I would suggest pursuing REB. And
Fortunately, the individual who posed this question has their hand raised, so potentially they could add a little more
yeah,
information to this. Please go ahead.
Thank you, Sarah, for your presentation and for answering the question. Just to give a little bit more context, yeah, I mean, we have the RAB for the study, of course. It's in terms of the patient partners, because if they are sitting around roundtable conversations, for example, naturally they will be sharing their lived experience, right? That's the whole point of designing this, to be able to incorporate into the main research project, to have balanced perspective and to have patient clinician guidelines and whatnot. So in terms of having PHA related information, I mean, some of these patient partners who we already have, they have, I mean, we have signatures in, appropriate documentation that, this is their contribution and how they get compensated. But in terms of the specific purpose, of course, do we need to consider REB because there's a potential for them to disclose PHI? I mean, obviously, it would not be. It'll be coded, and it'll be, it's a qualitative, it's a manuscript, and of course, data gets fed into the parent project. But it was a confusion that my colleague and I discussed last week, and we couldn't arrive at a conclusion. So I was hoping maybe some perspective or comments would be helpful to form some thoughts. Thank you.
again, I think if you're gaining perspectives, and they're not, um, it's not about their role as co-partners on the research team. I think that's of course entirely appropriate for for REB approval, right? And understanding too that they may have dual roles, but if you're gaining information from them or gaining perspectives as part of a qualitative study, I think it's entirely appropriate to pursue REB or if that's something you've already done, that sounds entirely appropriate.
Okay. Thank you.
Perfect. Well, we only have a couple of minutes left. I just want to do one final pass to see if there are any additional questions for our speaker before we end today's presentation. Okay. All right. If that's the case, thank you so much, Sarah, for coming and joining us today. This is an incredible talk, and I certainly look forward to reading the guideline once it's in completion. We certainly look forward to inviting those on the call to our next community engagement series webinar, which will be hosted on April 8th. It's titled Research as Relationship, Building Trust and Responsiveness in Community Engagement for Co-Created Studies of School Foods. And that's information is available on our website if you're interested in registering. But I wish everybody a wonderful rest of the day. Thank you for coming and certainly look forward to seeing you at our next session.